The dangers of masturbating too much. I'm Dr. Trish Leigh. In this video, let's talk about, can you masturbate too much? Definitely. Yes, indeed. And then let's break it down. What are the dangers? Okay, so first and foremost, I want you to know that if you're masturbating consistently and frequently, there's a reason. Healthy men, healthy women do not feel the need to masturbate every day or multiple times a day. Can masturbation be healthy in a healthy sex life and lifestyle? Yes, but not with the frequency and consistency of 2 to 7 times a week. If you are masturbating that frequently, it is serving a self-soothing need. We know this. So what we know from compulsive hypersexuality behavior disorder, which is a real disorder in the International Classification of Diseases, that your need to go back for sexual behavior is because your brain is pulling you back for mood regulation, making you feel okay. And it has to do with the dopamine that is released in your brain when you masturbate. So it becomes a masturbation dependency. So in every single video, I give a brain tip strategy to use at the end, and I'm going to share a couple with you in this one. But right now, I want you to think about this. If you're here watching this video, it's because you likely know that you masturbate a lot, and you want to know if that a lot is too much. So if it's a lot, it's serving a need that's more than just sexual. That's what I want you to know. And if you want to know for sure, stop masturbating. Stop masturbating for a week or two and see what happens in your brain. You will feel it. I know it from the thousands of people that I work with, that you will feel that pull in your brain, the compulsion, the compulsive need to go back. Now, another danger of masturbation is that masturbation doesn't happen alone. A healthy masturbation habit is when you stay in touch with the feelings in your body, like a massage. So if you get a healthy massage, you're feeling your muscles relax, you're feeling the tension in your body go away, but you're not anchoring into fantasy or into euphoric recall of porn, or you're not consuming pornography at the same time. So a healthy masturbation habit is one that is rooted in the feelings in your body. So another danger is that you're masturbating to fantasy or to pornography. And we know from the science that if you are consuming pornography and that fantasy that goes along with it, in fact, it is decreasing activity in your frontal lobe, and it is frying out the reward center in the middle of your brain, which that causes a whole host of problems. And I'm going to label them for you here just quickly. The quick and dirty on the majority of them here is that when your frontal lobe doesn't work well, your thinking, your cognition decreases. So your ability to think, remember, focus, feel motivated, go to work, your ability to remember things, your ability to plan something and follow through on it is decreased. At the same time, social anxiety goes through the roof. Anxiety in and of itself, health anxiety increases because your brain is dysregulated neurologically, meaning that it's using too much fast speed and too much slow speed, which is what pushes you back for more masturbation. So it will make you feel more depressed. It will make you feel general malaise or just not feeling well. It will give you an increase in emotional and mental health issues. We know this. The science shows this. It will also give you physical issues like erectile dysfunction. That happens because the reward center in your brain has become desensitized. So you need more mental and physical stimulation to become aroused. That's why you have to go back for more consistent and frequent masturbation. It's a dependency, a compulsion. It is not good for you. So another danger is it will make you go out of your way to masturbate instead of having sexual relations with your partner, if you have one, or instead of trying to go into the world and find a partner, you become complacent and content with self-soothing through masturbation. Now, I've heard from too many people, thousands and thousands of people, that what about my prostate? I'm trying to ward off prostate cancer. There is a hijacker in your brain. That's what hypersexuality compulsion is. It's your brain telling you, we need to masturbate again to feel okay. That hijacker will trick you. He lies to you. He tells you that you're masturbating to ward off prostate cancer. I'm here to tell you that the science on masturbating for prostate cancer is not conclusive. There's studies that show that masturbating too much is unhealthy for your prostate. There's studies that show there's no conclusions. If you go to your urologist, many times they don't know about compulsive hypersexuality behavior disorder. They don't ask you, do you masturbate a lot? They don't ask you, do you consume pornography? So, leading to your brain tip, if you have any problems or if you have a fear of prostate cancer, visit your urologist. But if you do, make sure you tell him or her that you watch pornography and that you masturbate a lot, because it changes the formula. Urologists are trained to tell people that if they're having prostate problems, masturbation's good for you. But if you masturbate a lot, masturbation is not good for you. The harms to the brain offset the risk of prostate cancer, which is incredibly low for young men. If you go to cancer.org, you will read there with your own eyes, very rare in men under 60. So masturbating a lot doesn't have to do with prostate cancer. Don't allow yourself to be tricked, because every time you allow yourself to be tricked, you're damaging your brain. Okay, if you decide that you're masturbating too much and this is not a healthy habit and you're looking for help on this journey, reach out to me. I have programs that can help. drtrishleigh.com. And until next time, control your brain or it'll control you.